I've really leaned on good doctors and nurses. I'm very lucky that the University of Utah is close, and they've got a great program for spinal cord injuries. There was a nurse there her name was Colleen Lowe, and she was on the rehab floor when I first had my accident, and then moved to urology. And she had been married to a man who was in a wheelchair. She helped me find other people that I could trust. But that was challenging because it's hard. Had I not had her, I don't know where I would have gone, because it's a hard thing to find people that you trust who know your situation. That was what was unique about Colleen. Right now, not a lot affects it because I had a urostomy and my bladder's gone. But prior to that, spasticity was an issue, and then my bladder had gotten real neurogenic. So I had, if I had, and I had a suprapubic tube, so urine would come in and go out really fast. But if any kind of hung around, then that was bad. And I got a lot of UTIs, and that really affected. Everything got worse when I got a UTI. When it comes to being a person with a spinal cord injury or a neurogenic bladder, there are all kinds of different solutions because there's all kinds of different problems. And so what becomes difficult is knowing when you have your problem, where to get answers, because a lot of urologists don't know. A lot of care doctors don't know, or they just give the same answer for everybody. And so what this study is going to do is going to take people who have had spinal cord or neurogenic bladders and say, okay, what affects your quality of life and what makes your quality of life the best in your situation? And then what's going to be fantastic is it's going to bring that information to the masses. So here's a number of people, and they've all had that similar situation. And here's where they got success. And it's going to give the patient all kinds of different options to know what to do, to see what's going to make their quality of life the very best. About a year and a half ago, I was having real issues with my neurogenic bladder. And I had a suprapubic tube, and I was dysreflexic a lot. I was in a lot of pain, and I didn't know what to do. And we tried some options, and finally the doc said, I think what's going to be best for you is urostomy. And I was petrified. What I envisioned that life with a urostomy was going to be like was pretty bad. A lot of leakage, and when I first broke my neck, I tried some options that were a mess, and I was wet a lot, and I'm telling you, it's humiliating. So if I had been able to go and say, here's a group of people who have gone through a urostomy, and it's not that bad, and this is what their quality of life is like now, I would have suffered through the suprapubic a lot less, because I stuck with that as long as I humanly possibly could, because I did not want to do a urostomy at all. Think about how much more valuable it is if the people who have gone through urostomy are saying, I'm looking online or reading a brochure or whatever, that say, it's not that bad, this isn't going to happen. I mean, there's things you got to deal with, but it can be managed, and you can live a rich and full life.